and welcome to Breaking It Down with Jodi Mark, Season 2. We have an amazing show for you tonight, and our episode is focused on mental health in the Black community. And these three amazing panelists have decided they're going to help us and educate all of us and just enlighten us on the subject that is a big subject that we need to talk about. So they're going to introduce themselves for you today. So LaTianna, you can go first.
Hi there, I am LaTianna. I'm the founder of House of Lala Inc., where I do creative arts, but also creative arts as a form of therapy. And I don't know what else you would like to know, but I think coming from a background of going through graduate school with marriage and family therapy, as well as ministry school, and being Black will bring, hopefully, different types of perspectives or experiences that people can really identify with. Yeah.
Enid?
Hi, everyone. My name is Enid Croom. I'm a licensed clinical social worker. I'm currently an ACT team lead. And ACT is an assertive community. Basically, I work with the severely and persistently mentally ill. And I've been doing that pretty much all of 2020. So imagine my 2020 at work. We've been really busy. I've been doing that for about a year now. Before that, I was working in trauma therapy. I'm retired military, so that's where I got started with my mental health journey. And I was a nurse before that in the military, and then transitioned into mental health. I love mental health. My transition in mental health was really a really awesome journey from the military to mental health. So I hope that I have something to offer in this panel and you enjoy this conversation.
And Luke?
All right. Hi, everybody. My name is Luke Jackson. I'm a nurse. I think more than anything else, I've been working in mental health actually since 1979 at a big state hospital in Kansas. I got started there as a young kid who was big and could speak. And so they hired me. And I've been literally in this field now for 41, going on 42 years. I've worked mostly in hospitals throughout the country, a lot in California, some in Missouri, some in Minnesota, some in Wisconsin. And I worked in a lot of inpatient units with acutely mentally ill, chronically mentally ill, and also outpatient programs. My last 15 years, I've been a program director or chief nursing officer. But I think in the end, I go back to, I am a nurse. And as a mental health nurse, I have found I have never stopped learning about mental health. I've never stopped experiencing brand new people in brand new situations with brand new sets of problems, and the learning just never stops. And so here I am as I get towards the end of my career, completely fascinated by what happens with mental illness and how to help people with it. So I'm very happy to be here and be a part of this today.
Yeah, I'm happy that all of you could join me today. It's so nice to have you on, see all of you, even though it's through Zoom, 2020, the new 2020. So first question, why is it so important to bring more awareness of mental health to the Black community? Lala?
Oh, yeah. And I know I was formulating in my head. It's always important. I don't think that shouldn't even be a question.
Right,
and so much it is behind it, especially with spirituality. So me being trained under a ministry school and being triggered by like certain people that were like, oh, they're inhabited by a spirit and things like that. And I think a lot in the Black community with spirituality, it makes it very hard to heal from mental health issues when it's also when they throw in the spirituality of like spirits and things like that. But it's also like a balance that we have to have. Like it's good coping skill to like, you know, go to church, pray and do things like that. But then when it comes to the judgment, it just gets to the core of the person to where it's kind of like feeling shamed or feeling guilty for any actions that they do. So I think it's important, at least maybe specifically with the church and mental health in the Black community, that I feel would be the most important place to kind of talk about that more without like, kind of like in a way bashing people or making them feel bad because it's something, I mean, that's only my opinion. Like there is something kind of spiritual going on, but I'm just gonna be upfront, like maybe personal rather than my professional self right now, but I have a family member that has struggled with like schizophrenia. It turned out like they didn't really have it, but it was like the way they would treat her in church.
You know, it's interesting you'd say that because schizophrenia is diagnosed twice as often in Black people than it is in white people. Yet research has shown that it doesn't occur any more frequently in any race. But
I have seen, and I was kind of like, oh, my connection's unstable.
We can still see you and hear you.
Okay,
yeah, we got you. But I think you bring up a really important point there.
Yeah.
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 Because the stigma is, I'm sorry, Enid, I'll just finish this real quick. The stigma is, I think, even greater in the Black community because the diagnoses that many people get are typically more severe, more quickly given to them, and are stay with them as labels. And I think as we've gone forward, we've learned that these labels that we call diagnoses are often wrong, are misapplied, and are meant to put people in a box. And nobody should live in a box. So we have to educate about what those labels are, what they really mean and what they don't mean. And especially, I think, within the Black community where the labels are more misapplied than anywhere else.
I totally agree with you on that, Luke. With working with the community and population I work with, that happens so often. I can go into a record. In fact, I went through 3 records this morning and found that to be the case. I've got one patient, I don't know how they can be diagnosed with schizophrenia, schizoaffective disorder, bipolar, schizoaffective disorder,
everything possible. That's right.
Depressed mood, and all within 3 years of each other. Like 1 year to have this diagnosis, the next year have this diagnosis, next year this diagnosis. And I'm like, how is this possible? Are you guys reading the records from the previous providers or previous hospitalizations? And I noticed the differences between the diagnosis from the clients of color and the clients, the white clients.
Right.
And I was like, can't be a thing, and it's a thing. So I totally agree with you. And it's been one of my things. And then that causes problems with their housing and sustained permanent safe housing, which is a whole other issue. We can do a whole other talk about that. But, my clients are jeopardy, their housing situations become jeopardized because they have this stigma. Now there are some who are like my psychiatrist and I talk about, there are some that are like really, really got schizophrenia or really have schizoaffective disorder, bipolar. But there's just some that are sitting there, I'm like, I'm not getting that from this person. They can live independently. They can function independently. They're not even taking medications that are normally for people with these delusions and hallucinations.
They really don't have those symptoms.
They don't have the symptoms. So, it's a thing.
And just to piggyback on that for a second, the trauma that goes with having that diagnosis is significant. Somebody tells you that you're schizophrenic, it is a major blow to who you are. And if they're wrong, well, they're the expert. How could they be wrong? So, the care that must be given to help people understand that, hey, just because somebody said it, don't make it true. And just because you had those symptoms for a minute doesn't mean you're going to have them your whole life. And there's a lot of other things we still have to explore here and understand. So going back to your question, Jodi, we need to bring this education and awareness to the community, because there's a lot of mistakes that happen in terms of how people are being treated, how they're being judged, how they're being categorized, and what that does to, you know, their long-term hopes, which are already, you know, facing a lot of other challenges.
Right. How can one find a really good health provider if all of that is happening, and say you went through like 5 and then you just lose hope in the system and you're like, well, I don't want to even go back anymore? How do you even feel comfortable again after that?
And you have to come with the right questions. Sometimes, like, trying to find one therapist, it's going to take time to build rapport in the first place. But if we come with questions and even like research, maybe think about, what type of therapy do I need? Do I need trauma-based? Do I want creative art therapy? Do I want cognitive behavior therapy? So finding a therapist when you interview them, like, what is your approach? Because a few times I will even like call a therapist just to try and see, when I was trying to transfer a client to a different therapist, because I was ending my time under my supervisor. And the lady was like, oh, well, she just generalized everything. I was like, well, no, how do you work with a client? How do you deal with them? What's the technique? Like, to feel safe. And even if they're like a white therapist or someone that's not Black, just be like straight up, hey, there's a lot of things going on for me as a Black person. Like, how would you carry me, contain me in this space of therapy?
I honestly never even thought of
confronted, but really interview. You got to interview your therapist.
I never thought about even interviewing a therapist. Like, I just thought, because honestly, like, in always like talking to my friends or who have, you know, gone to therapy, it's kind of like, who's the cheapest? Can I afford? More than the fact of like, who's going to help me the most? And I know that is so bad, but
it's reality.
Unfortunately, sometimes it comes down to that.
Because a lot of people do out of pocket because they don't want it on their insurance. They don't want a record for themselves. So then, yeah, it's going to kind of cost a lot. But going through insurance, yeah, it just depends. It really just depends. But asking the right questions, knowing what type of therapy you need at that time. You might want to deal with some trauma, so you might want to be with someone for a long time. So you gotta, but not to be scared when you have a few sessions, you want to quit. Like, I've done that before on a personal note. I was like, I don't think I really want to unhatch some things with you. I'm sad that my other therapist, that happened to be white, but she did creative art therapy. So that really got me in to getting my emotions out. So I feel like we got to have different modalities to help the Black community. And I think creativity helps us a lot, because we can't just straight out talk to people. Like, we do have a little guardedness about us, right? But I told her, like, oh, I think I'm done. Like, good therapist, yeah, but dude, I'm paying you.
Not for you.
I'm not ready to unhash certain things with you. I don't discern that you're the one, then I'm going to wait for another time.
I would piggyback on that to say that any therapist that is trained in trauma-informed care is a really good starting point, because if you do have mental illness, you have suffered trauma, without a doubt. It is one of the most traumatic illnesses you can possibly have. I think it is more traumatic than cancer, or, you know, it never leaves you. It alters everything that happens to you in your daily life, and you have a lot of things you need to learn. Somebody that doesn't understand that is not going to be able to help you. They have to be able to understand that, you know, you are living in a very different experience if you suffer from hallucinations, delusions, acute anxiety all the time, depression all the time. That is a life-altering illness. And it's not to say that you can't get help and there isn't hope. It's to say that somebody needs to understand how powerful that is in your life. And the therapists that are trained in trauma-informed care have a foundation in getting that. I also agree that the creative...
I feel like they also need, like, they need to know about the oppressiveness and the history of Black people as well. Because if they don't have that, what are you going to share with you? That's the number one thing of therapy. Like, you have to build trust before you even get into techniques. You have to build trust. build skills that they can emotionally handle the trauma unfolding when they want to talk about it, you know, that oppressiveness. And I've seen charts. I work at a mental state hospital right now as a creative art therapist. And there's a psychiatrist that literally wrote, like, they have delusions about being oppressed as a Black person or something crazy. And like, because they're the leader of the team, I can't change it. I can't change that treatment because it's like set in stone. But I'm like, is that really a delusion for him in his world?
Right.
Thinking oppressiveness, you know?
And who is he to say, you know, I mean, I've always said this to many staff over the years, don't judge somebody's quote delusions, because what you think is completely false may be completely real to them. And when we say a delusion is a fixed false belief, well, who's it false to? So I may not be able to observe or witness oppression or racism that another person experiences, but it doesn't mean I can't know it's real and that it is a dramatic effect on them. So I agree with you. And I also think that the creative therapies are becoming increasingly the therapies of choice for people with mental illness. We moved, when I worked at USC for 5 years, and I moved the entire therapy program into a creative therapy model because we found that that was what patients wanted to attend to, where they were the most expressive, where they were the most able to talk about what happened after group as if it was important to them. We saw, you know, tremendous responses to a wide variety of creative arts and creative therapies that we never saw with, you know, a traditional one-on-one psychotherapy, tell me about your mother kind of approach. You know, it's like, we don't care about your mother, really. I mean, if you want to talk about her, that's fine. But what really matters is what you're really feeling inside. And let's find a way to help you get that out, because when you're mentally ill, it's often very hard to express it. It's very hard to talk to somebody in a language they understand, but creative arts allow you to express that. And it's so critical that you be able to do that. That's as your part of your road to getting well. So that's cool.
And a caveat to that, Lucas, also while you're building that rapport and developing that relationship, is finding out ways to kind of develop that kind of relationship and getting to that portion of that,
right,
where you can figure out what's going to get to that person, like what you can build that relationship off of to really get to that person, how to reach that person. A lot of what I do is what actually one of my patients calls it. She calls it holistic therapy.
They like that word lately.
Yeah, she really is. Like, she goes, "You're just my holistic therapist. You're my best." She's like, "I've never met a therapist like you." And I'm like,
that's an amazing compliment.
Yeah, I mean, she really is. She's been through a lot. She's got a long, extensive history. She's been in therapy since she was a child. And so my approach with her was just really different, according to her, because I do yoga therapy. So we go out, we went out. This is, you know, even because it's COVID, it's just her and I anyway. So we went out, and it was at the beginning of COVID. We started before COVID, but we would go out. I get Boso pillows. We go out on mats. We sit down and we talk. We stretch while we're talking. And it wasn't something I just decided to do. She was concerned about weight. She's concerned about, you know, her body. So I said, why don't we do something that she feels and start feeling good about her body while she's cleansing her mind? And so that little thing, you know, for her was, you know, monumental. Right. And for me, I was just thinking, you know, let's just get out and move your body. But for her, it was huge. So listening and building that rapport is really crucial for clients, especially clients that have experienced, you know, mental illness and trauma. The trauma piece is so important. And
it is.
So I would mention there's a lot of therapists out there who don't listen to their clients, and listening to your clients and hearing them is so crucial.
And I think that goes along with the idea that there's a lot of therapists and doctors and nurses that don't form a relationship with their clients.
Right.
And the most difficult thing in being a mental health provider is making a relationship, a personal relationship that's also a therapeutic relationship. I have a daughter who's mentally ill, and she says her therapist, oh, they're just in it for the money, Dad. They don't really care about me. But she finally met a therapist that she says, hey, she really cares about me. I like her. I like her as a person. I like her as, you know, she's there for me. And that person has obviously made a human connection that it really shouldn't matter your race. Yeah. I mean, it matters that you really can understand where somebody else is coming from and care about them, but you still have to keep some separation because, you know, you're not getting into a truly personal relationship, but it's very personal what we do. Right. And so it's hard to find that therapist that understands those boundaries.
Right. The point I was making with that last client I was talking about, she happens to be white. And she said, going to your point, Jodi, is that she was saying that she thinks had I been a white therapist, I wouldn't have made that connection. Because me being Black has allowed me to really be able to listen to her and hear her pain and be open to that because of my Blackness. And she, as a client, she recognized that in me as a person. I thought that was really powerful.
So, that's amazing.
That is. That really is.
Very amazing. Because
first I tried to bring a tear to my eye.
Yeah. That's so nice that you're making such a difference in her life, and she's like seeing it and like actually like she's unbiased, because that's another thing. You know, you want a person that's going to be unbiased and not bring their outside like environment into the room.
Values.
And I feel like that's why a lot of the Black community is also scared if they have, per se, like maybe a white therapist, because they're like, what do they think outside of, especially right now in 2020, Black Lives Matter? What do you think about it? Like,
or are they talking about me?
Right, exactly. Like, do you think that this is like, you know, stereotypical Black person telling you I feel this way because of 2020, I'm depressed, or are you actually listening to me? So that's another thing. Yeah. You know, 2020, the Black community is facing a lot of depression and anxiety and what's happening in the world and around you. Especially living in LA, I've seen a lot of my friends like, oh, I need to move, or I can't be in this place because I need to go to a community where I know that they like Black people. And I'm just like, oh my gosh, that's what we're doing with our lives now. Like, just to be safe on our own streets, we think we have to. But I'm like, LA is like a melting pot. Like, you should even feel like that in LA. You know what I mean? So it's
I live in North Carolina.
Yeah, that's what I'm saying.
What are you talking about?
That's what I'm saying. It's happening everywhere. And then when I heard one of my friends say that in LA, I went, this is LA? Like, where do you live? Like, I was like, but it's happening everywhere. And that's the sad truth, is that's what certain people in the Black community are thinking. And I didn't realize that until she said that to me, and I said, oh my, I was like, but she lives in Beverly Hills, so that's another thing.
That's nice.
Wow.
So go ahead. I'm sorry, finish.
No, but I'm done, but I just thought it was weird.
Interesting, because people are moving here from New York and New Jersey saying the same thing, and I'm like, you're coming to North Carolina from New York? Okay.
Right.
North Carolina. Well, I live in Charlotte, but it's a little progressive, but really?
New York. I do want to bring up kind of like a theory with cognitive behavior therapy, like that treatment, that we go over the thing called like core beliefs.
Right.
And so if we have a core belief of the world is unsafe, and especially in the Black community, like that tends to be our core belief. The world is unsafe. So like where to go, where to feel safe. So I think, like you were saying, like the more we talk about mental health, mental illness, how to get well, different modalities of getting well, I think it would help break that core, even though that core will take time, because that's how your lens is operated in, with that core, whether it's that or I am unlovable or I am incompetent, like things like that. I know when I was thinking before coming on today, that core belief of the world is unsafe. I can't trust the world. I can't trust healthcare. I can't trust, you know, having to break that is hard, but it does dissolve a bit with the relationship, like everyone was like mentioning today.
And how do we start breaking that, especially in younger generations, because they only see what their parents are telling them, or their parents might be not even saying anything about mental health, and then they don't think anything of it. But how can we help younger generations to realize that mental health is something to be okay, and actually celebrate you talking about your mental health, because that's a good thing?
Yeah. Honestly, it'd be great if it was implemented in the schools. Like, I know there's always like an outside thing where we would go in and do groups or something like that. But if it was just integrated in the academics, mental health, and assessing every year, like we assess like what the physical like thing, the PE, how many push-ups can you do? But like maybe emotional quotient, you know, like what's your emotional intelligence, and like work on that, like build it while they're young. Because by the time you're like 7, it's crystallized the way you see things. And if you don't have parents that know better, and it's hard to tell them because they're used to the generational things of what's happening, you know. It only takes one person though within the family to break that system, but it takes time. We're evolving people, you know. That would be great to see it in school. Just
some schools are doing that.
My son's schools does that.
Yeah.
Yeah, they have like, they call it moral focus, but it's like a moral focus and emotional intelligence. It's
How does
actually
that work?
curriculum.
Yeah.
They write papers about their feelings. They give them topics to discuss, and then they discuss it in small groups, and then they write papers on it. And he's only in 5th grade, but they've been doing it since 3rd grade.
Yeah.
So yeah, they do moral focus, but they start doing the independent and the group work in 4th grade.
Mm-hmm.
But they do it, the whole school does it, but they start really writing papers about it and having group discussions about those topics, moral focus and emotional intelligence, in 4th grade. He goes to a charter school though. So
yeah. I think, you know, it depends on the school and the budget and the progressiveness of it. But like my kids' school, they do mindfulness in their PE class. Mm-hmm. They do, I think this is in a social studies program. They do a cultural awareness thing. So like my kid came home one day, she's in 5th grade, and she said they paired them up, randomly paired them up, and then they had to interview each other for about 2 minutes, and they had a series of little questions asked. And then after the interview, they had to sit down and write their opinions of that person based on another series of questions which they hadn't seen in advance. What do you think? Where do you think this person lives? Who do you think they're you know, what's their life like? Just a series of questions like that. And then they would share their answers with each other, and the other kid would read, you know, their partner's answer, and they'd say, no, that's wrong. No, you know, and it would sort of teach you how you just sort of come to judgments about each other with very little information.
right.
Yeah.
And you just sort of make assumptions. And, you know, you find out you're just so wrong in most cases, because you've got this training from wherever you get it as a youngster, you know, and so that's kind of powerful stuff. So I do see that those sorts of things beginning to happen in schools, but, you know, it's not near enough. You know, there's just not enough awareness of our implicit biases and our, you know, our ignorance about other cultures and other people and how they live and what they do and don't do. And there just needs to be a lot more of that. Mm-hmm. I wanted to just circle back, though, to what your question was at the beginning here about 15 minutes ago about how do you find a provider, a mental health provider. And I'd be curious to ask you, I think LaTianna talked about interviewing, you know, somebody to see if they make a good therapist or a good provider for you. What would your interview, I'd ask everybody, like, what would your interview consist of? What would you ask? How would you do that?
I've done it. I've done it. I have done it.
Yeah.
I had to do it.
So share.
My son has autism. So, and he's got GAD. So it's for him generalized anxiety disorder for those.
Yeah, my daughter has it too. I get you.
Yeah. And with the autism, you know, that comes with the tics and the fidgeting and and so for me to find someone, for one, to take that accepts our insurance, the TRICARE, and because with all the other therapies and things he has to, it's very costly. So behavioral, all the behavioral therapies and all that stuff. But also to add outpatient therapy for the GAD, it's a challenge. So when he was younger, it was play therapy and he did really well with it, but he's kind of outgrown that now because he's almost a preteen and he's kind of a big boy now. Right. So he wants something different. And so literally he articulated that to me in his very eloquent manner. And so we have to interview a new therapist. So I actually literally make an appointment and I tell them that I'm making an appointment to interview you for therapy. I explain to them who I am, what my son is, what his level of functioning is. I give them the whole entire biography in advance. And then I ask them their biography, what they teach, what their level of education is, even though I look it up already. But I ask them all of that before I make the appointment. And then I ask them what therapies they use. And I did this before I became a therapist. So I do this with my doctors too. I do that with my personal providers and I do that with my pediatricians. So, and that's probably because I worked in a hospital for 24 years. Yeah. And because you have to find a good fit. Because sometimes not every provider, whether it's your doctor, your dentist, or everything, I do with my dentist too, is not a good fit. So you want to have the best provider for you, that if you're paying money for somebody to treat you medically, or a dentist to treat your teeth, or a mental health provider that's going to mess with your mind, you want to have the best fit. So especially it's for my son, absolutely. I want the best fit. So I vet them. And then when I allow them to vet me by giving them the bio, and then I go and meet them and I tell them the first visit's a consultation visit. I let them aware that this may be a consultation for them, but it's also a consultation for me. And I make it very clear. And then we go to that visit. And then it's a trial run. So I say, this is our trial visit. This is our trial run, which is trial sessions, whatever it is, whether it's for me, or my husband or my son, because we all go. Mm-hmm. So I have to go. I have my own set of things. My husband has a set of things and my son has a set of things. So, we all make sure that and I've vetted them all. I vetted them for my husband. I vetted it for my son. I vetted it for myself. And that's the order of operations that I take. Mm-hmm. That's just the way I've done it. And I've been doing it for 12 years now.
Yeah. You got it down.
I have a question though, because you said consultation. I want to make that clear. When you're first going to a therapist, you get a free consultation with them to have that interview?
You can ask for one, and oftentimes they will do it to take in a client. Like I do it for some of my clients. I have taken on for my private clients. I do that. I will do a consultation. I'll give them a freebie.
Do you say that's you should be looking for that and somebody not taking advantage of you?
Because most of the time they'll come back.
You're not going to get far with one visit.
You're not going to it's not going to, exactly. You're not going to have a lot of success with just one visit. Okay. But it is more of that's part of you building the rapport.
Okay. Knowing if it's a fit for you.
And honestly, I think it shows that person is serious about getting help. And those are the clients you want, those are the clients you really.
Exactly.
Mm-hmm. So. Lala, how do you go about it? I want to know what questions you ask.
Well, me?
When I go to seek treatment or when?
Yeah, whichever.
With me, in the past I've done private pay, and then before I've done through Kaiser. So the Kaiser system, forever calling, forever taking forever. They do an intake with you. You have to go to the visit. And then they say, we have too many patients. We don't have enough therapists. So we're going to outsource you. So you get outsourced. So this is where it gets really frustrating for people wanting mental health services. And they kind of tend to just stop there. It's taking forever. So they give you this number to call and they give you a list of therapists. Or you can look on Psychology Today or something like that, and it will tell you what kind of services they offer, what kind of techniques they might be doing. and then kind of just going from there. So one time I did it through Kaiser and it was fine. Like it didn't work. Actually, no, it was not fine. It didn't work. I went through 2 people. I had to fire them because when they find out I'm a creative art therapist, I become the therapist. And I'm like, I'm paying you my copay for you to help me. And one time a lady got really mad. Like she got really mad. She was just like, well, you should have told me earlier. And I was like, that I'm quitting you? Like, coping skills, lady. So it gets weird, but there's still hope. So I was going to grad school at the time. They made us go to therapy, which I was glad they did that to graduate. And then my professor was like, oh, I recommend somebody, see if they have your insurance. And they did, and she had to play therapy. She had a sand tray. So I was ready. I was on it. And she was white, but you know what? She knew how to connect to me. She knew how I needed patience and kindness. Yeah. And to this day, I almost want to cry because you're tired. And I was like, no. But I bought her a sand tray set, so I can't wait to start doing sand tray therapy because that was a gold mine.
What is sand tray therapy?
It's a big sandbox and lots of figurines. And you put sand in it, but the client gets to pick the figurines from the shelf. It could be like clouds, stars, people, a gel. She had a little gel thing I would use a lot, and like a lot of Indians and different figurines. So it's free flow kind of session. Like, so for me, I would like, okay, I guess I'm gonna pick this, this, that, and I put it on the sand tray any way I want. And then eventually we'll talk about it, but she doesn't analyze it. So this is what I also do with like my psych patients. But I love doing like creative art therapy, but that's part of the process with creative arts. It's not judging the art, judging what you did or trying to analyze it. It was more of asking the right questions for me to kind of see like, wow, I actually made an encampment of army men. Some are buried, some weren't. And then there's a girl on the top. So I was like, oh yeah, that's like my warfare with love. And then like, it was funny. I didn't know I created that until the end. But it gives you a deeper insight, which I think that technique was really interesting. And then she'll add maybe like cognitive behavior therapy, which is how you think, or when a situation happens, how you think about it, the automatic thoughts, how you feel, how intense, changing the thought, and then how do you feel from changing it. So that was like CBT 101 right there. Might have been too fast to.
No, I like that. I like that. That's actually very interesting. It kind of makes me like, you know, those that like sand that goes like from wet, if it's like in the water and stuff like that, like the things like the textural stuff, which like calms you down. That's what it kind of reminds me of too, because you're playing with all the sand while you're building.
Yeah, and it's funny because it's like it's a kid thing, right? I'm like, it feels like it too.
Yeah, but
we're all still kids inside.
Yes, and we gotta remain that. That's a good mental health tip right there, like what you just said.
We're all still kids, and our kid is hurt. You know, somewhere along the way, our kid still gets hurt from time to time.
Yeah,
it does.
All right, so this part is a little kind of segment, kind of multi questions. So the first question is, how do the following affect mental health among the Black community? So I'm gonna give you words that then you're gonna just go off of. So the first one, how do the following affect the mental, how do the following affect mental health among the Black community? First one is racism.
You want to give us all? So one at a time. Okay.
Oh yeah, we can do it all. So racism, poverty, not having the right help, whether that be a therapist, doctor, the greater stigma in their own community about mental health, lack of information given to the Black community, incarceration, and trauma. So you can say how any of those. If you want to talk more about one topic, go for it. It's a lot to unpack.
Yeah, I know there's a lot to unpack.
Lack of information, trauma. What was the other one?
Incarceration, trauma, lack of information, racism, poverty, the greater stigma in our own community about mental health, and not having the right help. Whether that be therapist, doctor,
Wow. Wow.
a lot.
I mean, for me, the starting point there is a stigma that, you know, stigma exists in all communities towards mental illness, towards having it or other people who have it. I think in some communities, at least it's been my experience in the Black community, it maybe is worse. There is both stigma from outside people looking in, providers, your neighbors, whatever, as well as from within the community that I think is very strong. You know, I've dealt with a lot of African-American families who just have a very hard time accepting that there is a mental health problem, or that, you know, I've worked with, for instance, a lot of dementia patients as well. And, you know, they bring their mom or dad and they say, you know, he's just a little confused. And I say, he's a lot more than confused. That this is what's going on with dementia. And it just is very hard to hear. It's very hard to hear. And I would like to hear from the other panelists as to, you know, what some of the roots of this may be and how we get at that. But it's been my experience that that is a deep, deeply held beliefs within the Black community about the stigma of mental illness and wanting to avoid it at all costs, even if it means denial. And so that would be kind of one starting point for me. And you know, it's something that you can't deal with the illness until you're willing to accept that the illness exists. Otherwise, there's just no progress to be made on any front, as far as I can see. You can't educate people if they're not saying, hey, I need some education on this, right? You can't get past stereotypes if they're not willing to say, hey, these are stereotypes that I've come to believe in. So, you know, to me, that's a starting point.
It's definitely that intergenerational trauma, you know, from slavery. Like, we got to protect our own. Like, don't trust anyone in the Tuskegee experiments where they gave us, you know, diseases. And I remember like my grandparents even saying, I'm not going to the doctor. Like, I don't need to go to the doctor. Right. They gave me all these meds and look, I only take one med now and I'm just fine. Like, it's almost right with that core belief I mentioned earlier, like the world is unsafe. It really is. And that the trauma that's in the blood, that's in the genes, that just passes down.
Mm-hmm. It's like an intergenerational, it's almost like becomes part of the genetics. I've heard that said. I don't know much about the research on that, but I certainly have heard it said that there is an actual genetic passing of this through, you know, now we're on, you know, what, 10, 15 generations, 20 generations in the American experience. And that over time that is literally passed genetically. You know?
I don't know if it's genetics, but I know from, I guess, growing up, you always hear stories about not getting the right help in the Black community, or asking for help and not being able to get the right kind of help. So then you think, I'm not going to get the right kind of help anyway, so I'll just deal with it on my own, or nothing, like how you're saying, like the world's kind of against me, like I can do it better than they can.
I was just referring to the intergenerational trauma. And how that, you know,
I remember in trauma class, there was like a study my professor brought up. It wasn't with slavery though. I forget what area, but it was where there was like a lot of war and things like that. And I don't know, I can't describe it. Like, she described it way better, but she was talking about when the war happened and then they had to like walk and leave, and like their feet would hurt and stuff like that. And then like the next generation would always like talk about their feet, or like, I don't know. It was interesting. Mm-hmm. So my bad if that was a bit of confusion, but maybe just, I should say, the behaviors and the thoughts that carry on generationally from the trauma that started through slavery. I don't know if that might make more sense or not.
Yeah, well, there's actually evidence that, you know, when you experience significant trauma, it actually can change your genetic coding for how you experience other events that happen, or how your offspring would experience events that happen down the road. That we think genetics are so simple that it's just a matter of your hair color, your eye color, your how your liver works. But it's actually much deeper than that, and the programming is much deeper than that, and that it has a lot to do with your experiences throughout your life, and you can actually pass those on through your genes to the next generation. And that's a lot of the new thinking about this, and it makes a lot of sense why some of this is deeply embedded, not just in the African American community, but you can look at the American Indian community, and any of these different groups of people that have experienced this level of trauma, level of abuse, level of pain. How does it get that actually is passed from one generation to the next, not just through the stories, not just through the hearing about the events, not just through reading in the history books and learning about it, but actually a physical passing of it, which makes it incredibly difficult to overcome. You have to start by accepting that as a possible reality, I think.
And it always comes down to one. I think I remember in family systems learning that and realizing it only just takes one person that can shift the family system for that next generation. So like this creating awareness now, or like, I know a lot of people use like Instagram and social media, and they find facts or things, or they find information, and it might just spark a seed. It might bring a little bit of hope, and they might shift, or they might go see a therapist, and that one person can really domino affect the whole family, even though it's hard, because standing your ground while you're changing, you're shifting the family system, right? And everyone's like, why are you acting like that now? Like, why are you going to therapy? I remember actually, I had an African-American client, and she was getting therapy for anxiety. And she was progressing, getting better. And her friends are like, who's your therapist? Like, I want to know, they got curious. So it only just takes, I guess I hope to leave with that hope for everyone, in the Black community. It just takes one. It takes one.
And caveat to that is the generation, a lot of the young people now, they are making moves, they're doing different things, they're moving a little different, and it's encouraging. It's a little scary sometimes, but it's encouraging as well.
They're kind of like, I'm watching you.
I kind of look at them from like at the other side of my eye, corner of my eye, but because I also work with youth, I volunteer. Some of the volunteer work me and my husband do, and they amaze me. So it is encouraging to see them move, because when we go out into the community and we work with them as a couple, and we mentor to them, they're a lot more open than we think they are going to be. So being able to communicate with them about possibility and the future and things that they can access and the things that they can do, they are much more open than we give them credit for.
It is so true. I mean, if you look at videos from 30, 40 years ago of protests that took place over abuse of Black people, there were Black people that were in the crowds. It was predominantly Black. And you look at what's happening today, it's a complete sea of every race and every people, and it's the youth. And they are out there together as a group saying, no more, no more. And that's, an astonishing change in 30 years. It seems really slow, but honestly, when you look at it, this generation, as much as we may think they're spoiled at sometimes, and I think
spoiled and lazy, but they're
but they have a better understanding of this than any kids I've ever seen before.
Right.
And they call me out on stuff all the time. My daughter, was asking me, we were driving in a car one night. We go out for drives to deal with COVID. We go out late at night, put the music on, talk, and I take my younger kids out. She was talking to me about how I was, I was using cultural appropriation, because I said that these, anybody that wants to wear these cornrows, if they want to wear them, they can. And boy, I got lit up. I got lit up. And she came home and she told her older sisters, and then they lit me up the next day. And, all of them are like, Dad, you don't understand it. You don't get it. You're too old to get it. And, I really had to take a step back and think about, what I was saying and how I had maybe missed the point on this. They got it. They understood it. I needed to think a little bit more about it, but it's amazing the kids and what they see and understand that just went right by us. Well, I say us, a lot of people in past generations. So I think it is really changing. It really is. And I couldn't be happier.
Also, mental health is being talked about more too.
Yep.
In that generation. Definitely more than me and my friends ever talked about it. My younger cousins will be like, oh, I need a mental health day. And I'll be like, what?
Yeah, hashtag self-care is very popular.
Yes, it really is.
Technology has helped. The information systems that we have now is very helpful with that.
Yeah. Mental health app.
Trending, but whatever exposure it takes, whatever exposure it takes.
True. Sure. All exposure is good exposure when it comes to, just getting the word out and letting people know, hey, this is fine to talk about.
Yeah, because I also remember when I first started working, they never had like a mental health day. And now certain jobs have mental health days if you need a mental health day. And I said, that's a thing.
Right.
That is so great. Because sometimes
3 a year at my hospital.
Yeah, I'm like, ooh, I need a mental health day. And then sometimes you're like, okay, but don't take advantage of the mental health. You don't need it. It's one of those things where then you're like, oh no, but what is mental health? Like you gotta actually really tell yourself. You don't just need to go lay in bed because you're just lazy. Sometimes I have to tell myself that.
Body says rest. You must
exactly. But what are some of the most important things that one can do right now to help protect their own mental health? Are there any things you might do in your own time?
Bubble bath.
Oh yeah.
Already, I'm like looking at
self-care.
That's a good one, LaTianna. I'm going to try that. I haven't done one of those.
Nice. Candles, sensory, anything sensory.
Yeah,
having room sensorized, everything. As we talk about.
Yes. Mine is music. Whatever mood I'm in is what I turn on, kind of thing. Like
I came to the conclusion sometime back that we all have some mental health issues. Not a person walking around that doesn't, and we all can be mentally ill at a given time. I mean, they say depression affects half of the population on Earth. So it's just after the common cold, it's the most common illness that exists. So acknowledging that and getting people to understand that you're going to have some times in your life where you're a little mentally ill. And that just accepting that and that there's things you can do when you are is a really good way to keep it from becoming a big problem. Hey, I'm definitely feeling depression. And I know it's like this COVID thing has done that to me. It's like I've been stuck at home with these kids but it's been good because I've learned a lot too. But I think just acknowledging that mental illness is not like something that is this dreaded horrible thing. It's just part of life.
Right.
Just like getting a cold.
Me. Not like a you versus me or it's them and
right. Oh, look at them. They're strange. They've got they're
it's just another facet of being a person living and walking, breathing on this planet.
It really is.
Another part of being a person.
And we're all unique with our own illnesses too.
Right.
Whether you have a little OCD or whether you've got a little anxiety or whether you've got a little, bizarre thinking going on. Hey, everybody's got something.
That's a good self-care idea. Make a skit out of the different diagnoses.
Right.
That was fun. Actually, that brings
make it a
happened at work today. I'm sorry.
Sorry, what were you saying?
I'm sorry. I'm sorry. I didn't interrupt you. We did a funny thing at work today. We started talking about like the meter, the dorky, quirky, kooky, freaky scale at work. We were like talking about each other. Like we were all just saying how everybody, my team, I got to pick my entire team. So I hired everybody on my team. And like ACT is really specific. So you have to have exactly this person, like you have to have a nurse, a psychiatrist, a team lead, a vocational specialist, and all these members, okay? But I got to choose every single person on my team except for the psychiatrist. He was already there. So when I chose them, it's like I chose them for their person, for who they were and the things that they said in their interview, but plus their resume out of the other candidates, and how I chose them. And it's like, I looked at this, I made this imaginary meter. And the reason why I'm talking about this is because we were talking about how we all, you know, Luke said about we're all kind of a little mentally ill, and we all are kind of quirky. So I was thinking about the little freak meter, because I called it a freak meter, everybody on my team. And we all are really super quirky. Like I have this thing in our morning meeting. We have a meeting every day, 5 days a week, Monday through Friday, 9:00. And I'm like, I have this thing about phones buzzing if they're on mute or they're from vibration. It's like my military training. No phones go off at all during a meeting. It drives me crazy. So that's my quirky thing. Whose phone is that? You know, if the phone goes off, I'll like look at the phone, the direction of the person with the phone. I got one person, she's always rocking in her chair. The other one's always like in the meeting, like putting hand sanitizer and lotion on. And I notice everything in the meeting. Like I can tell you I could have my eyes closed and just listen. And I know who's doing what and where they're sitting, even if they switch chairs. And I can tell by what they're doing and the movement in the thing. And I could, this was a thing, I could tell they switched chairs. I closed my eyes, they put a bandana on me, and I could tell who was in each chair today.
Oh my gosh.
So we did it like an exercise, because we're all such freaks. I said, we are, in a good way, I said it like, and it was such a great kind of icebreaker exercise we did for morning meeting, just to say, you know, we may be who we are, and we go out and we go in the community and we're supporting our clients, our consumers. You know, how far away are we from our consumers, you know? Because we all have our little bit of OCD. We all have our little bit of anxiety. We all have our little bit of, you know, whatever, you know? But we're probably just one twig away from that little thing, that little vine breaking, and we could be right there too. So before you get on your little high horse or take yourself, you know, thinking you're so much better than them, you know, just check yourself before you wreck yourself, in other words. So that was like my little thing with my team, to kind of just remind everybody where you were, you know. So anyway, that was my caveat, and I just thought I'd share that.
It's fun though.
I enjoy
That's my free meter.
Work.
All right, we're about to call it a night, even though we could keep going for hours about this topic. But before we go, I just want to ask you one more question. So everything we've talked about, what is one thing that you want the listeners to take away from this episode specifically?
I'll start. I'll say, don't be afraid to speak about your issues, your challenges, your feelings. If you keep them in, they will hurt you. If you share them with others and you recognize that you're, like we said, everybody's got them one way or another. And if they're bothering you, get them out, and that's how you can deal with them. So if you keep it in, that's your big mistake. And it's scary, but everything that's scary is not scary once we do it and realize, hey, that wasn't so bad.
Lala?
I would say embrace the dark and the light. Don't see life as good or bad. I think that mindset really can harm you. I think knowing that you're going to have emotions that don't feel comfortable, and that's okay. But like he was saying, like, if feel it to heal it, but also start visualizing. And so maybe that spiritual aspect. Think about the spiritual aspects of life with mental health. So visualize happiness. What does that look like? Maybe lay in your bed and meditate and just vision, how would it feel to blank, and just get in that kind of space when it gets dark. Or when it gets dark, just realize, okay, I'm not alone. Like, you're not alone, you're loved. Anyone that's watching this out there, like, you are loved and truly cared for and adored. Like, you're here for a reason. Always, bring anything up into the light, but also embrace the dark. Don't make the dark seem so bad. I don't know if that resonates or makes any sense, but that's what I'm sensing.
It did. And Enid?
What I would say, what they said, and love yourself. Just give yourself a hug. Love on yourself. And embrace that, really. And thank you so much for watching, and thank you so much for having us and into your home or wherever you're listening and watching.
Yeah. Thank you all for taking the time out tonight to, be here with us and sharing your expertise and educating all of us. Because I know I've learned so much on just my own mental health, honestly. But thank you. I really appreciate all of you and your time. And I had a great night.
Thank you.
Bye.
Bye.